If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. This is our 12th season finale, and it's great to be with you today. As you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. Now, it's more important than ever to become an informed patient, and we are here to bring you timely health discussions. For those who are new to the show, there are two ways to get your questions in. First, you can call the live phone line at 718-499-6101. Or second, and this is new this year, during the show you can actually send us an email to askthedoctor@netny.net. And we're going to bring them into tonight's discussion. You can comment on clothing, on styles, haircuts, anything you want. We're going to talk about this. Now, for this episode, this is a stellar episode. We've alerted the phone company to expect a surge of phone calls. We have Dr. Kanchmala Kadapati, an internal medicine attending at New York Methodist Hospital. Next to her is Dr. Bruce Garner, Chief of Rheumatology at Lutheran Medical Center, and Dr. Daniel Stevens, a laparoscopic surgeon, a general surgeon, and at the Metropolitan Hospital Center. Well, I'm Dr. Steve Garner, and I approve that message. No, I mean, I can't take these anymore. I wish the election would just come on. You know, we're getting so many of these ads. But anyway, let's forge ahead because I know the phones are already starting to light up. What's in the news? And there was an interesting story today. Sleepiness might be in the genes. No matter how little sleep some people get, right? They're always walking around chipper, alert, and other people getting 10 hours of sleep, they're walking around tired. It turns out that about 25% of the public has a gene that's an abnormal gene that makes you feel tired no matter how much you sleep. So I don't know if anybody out there can relate to that, but you get so much sleep you walk around tired and your husband is up and around with 3 hours sleep. Not much can be done about it. That's the problem. I mean, you can think about taking caffeine to give you a boost, but we won't be able to really do anything until we can do something to change the gene. Now, here's an intriguing piece in the news. Having your hair cut may save your life. I looked at this. I said, what could that be? Now, we know that African-American men have the highest rate of high blood pressure-related deaths, like stroke and heart attacks and so on, 3 times more than white men or Caucasian men, partly because of the high blood pressure goes untreated. Now, the thing is, we have all these ways to treat it, all the great medication, but we can't get the patients to know if they have high blood pressure or not. So they did a study where they went to 17 barbershops in Dallas, and they said, we want you to take blood pressure, and we want you to encourage the people to go to their doctor. And you could give them a reward. If they go to their doctor after the blood pressure check, you give them a free haircut. And actually, amazing results occurred where people started getting treated properly for high blood pressure. And it shows us that sometimes the simplest intervention can be more important than all these widespread health fairs that we have and so on. You know, the guy goes into the barber shop, he talks to the barber. It's a perfect spot to have it done. So I think this is a great thing. It's an epidemic right now, particularly in the African-American community, and we have to do something about it. This is a great start. I look to possible other diseases for that. I don't know if anybody saw this kind of a very sad situation where college students were felled after drinking a product called 4 Loko. And it turns out that this one drink in this bottle has equivalent alcohol to a 6-pack of beer. And they put caffeine in, a tremendous amount of caffeine, so you don't realize you're tired. You're getting faked out. The body's drinking and thinks, oh, I'm not drinking that much. And 9 people showed up at the hospital with lethal levels. Luckily, most of them are going to survive. But it's something to be on the lookout for. You want to try and talk to your kids about this because it's on sale in this area. This happened in New Jersey. So 4 Loko is the name of the material. Now, an aspirin a day may keep the surgeon away, particularly for those at high risk for colon cancer. It's something, a study that showed about a 25% reduction in colon cancer in people taking a baby aspirin a day. It doesn't mean that everybody should do that and go out and take it. It means you call your doctor and ask if it's appropriate because there are risks to taking a baby aspirin a day. But it's something that was kind of surprising. It was an excellent study. It was performed at a top-notch medical center. So you want to ask your doctor about that if you're not already taking the baby aspirin. Now, a new study also showed, that was out today, that physically active women were 25% less likely to be diagnosed with breast cancer. So you can have a better chance of not getting it. But more importantly, I think it showed once you get it, if you exercise, you cut down your risk of dying and cut down your risk of recurrence by 41%. So this is a significant number. Again, get out there, get in the park. If you're near Prospect Park or you're going to walk up and down the stairs, avoid taking the car to the corner to buy something. Something very important to do, particularly for women. Now, our myths for the day, we have 3 myths left in this season. I'll see how you do in this. You shave your hair, right? You go, maybe you get it waxed in the beauty parlor or something. It's going to grow back thicker when it comes back, particularly on the legs. Anybody, any thoughts on that myth or truth? Well, I know whenever I get my legs waxed, this is what happens. No. What happens is when it grows back, it doesn't grow back in a tapered appearance, so you get faked out thinking, oh, yeah, this is thicker. It's not really thicker. After a few weeks, it'll look identical to that it was before, so it's a myth. It does not come back darker. It doesn't come back coarser. It's the same hair coming back. Now, your heart stops beating whenever you sneeze. Is that true or false?
I would guess that's false.
That is absolutely false. And the reason it's false is you may get a little irregular heartbeat as the pressure changes in your chest, altering the blood flow back to the heart, but your heart does not stop beating with a sneeze. And finally, for those who are, if you're eating, turn down the sets at this time. Green mucus indicates a sinus infection, right? And this is something that I know I was taught in medical school. If it goes from clear to green, you got an infection, you better treat with antibiotics. Turns out that's not true. They took all people with green mucus, and I don't know, that must have been some room. Anyway, they decided that there was no way to correlate whether or not you had a bacterial infection or whether you just had runny nose from a cold. So, interesting thing. Now, I say hello to Monsignor Bennett, and Monsignor, how many finales now? 12 finales Monsignor has been here for. Missed only one show in the entire time. We have an interesting quiz that the Quizmaster gave this week. Created a lot of controversy, but I'm going to try and phrase it in such a way that puts it in the correct way. Now, the myth dealt with the fact that one holiday, aside behind Christmas, now we know that Christmas has a large commercial sales. What holiday other than Christmas has the second most, and $22 billion in sales, $22 billion, which is a lot of money. So let's figure out what the answer is to that. We're going to be accepting now quiz questions from the audience. So if you have a quiz at home and you think this would be a good one, email them to askthe.doctor@netny.net. The chosen questions are going to be read next season on the air, and credit will be given to the author. Okay? So I think we got the stage is set, the excitement is brewing. We're going to take a short break, and when we come back, we're going to go to your questions. Now, the topics, remember, are internal medicine, rheumatology, surgery. And in laparoscopic surgery, we're going to find out what exactly that means. The number to call, 718-499-6101. And remember, you can email questions or comments to askthe.doctor@netny.net. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. Welcome back to Ask the Doctor, where our topics are internal medicine, rheumatology, and laparoscopic surgery. And I just want to say this is the 45th anniversary of, you know what? Anybody? Sound of Music. 45th anniversary. And in this season, we've been having theme days. You know, what's your favorite neighborhood, favorite food, and so on. Today we're going to talk about what's your all-time favorite movie. Now I'm going to, Dr. Katapati, we're going to introduce her. Let's go around. It's a good time. What's your favorite movie, by the way?
I'll stick with Sound of Music.
Sound is a very good movie.
Yeah.
Where were you when you first saw it? You remember when you first saw that?
With the kids, really. Here. Yeah.
In the United States.
In the United States. Yeah.
And your daughter, she's got to get some kind of an award because she goes all. Where does she travel?
She's such a trooper. Oh, forget it. All the way from Bay Ridge to Bronx.
To go to high school. Every day to go to Bronx High School of Science, prestigious high school. A lot of famous people have graduated from there.
Yeah,
but it's really
seven Nobel laureates from that school. So I think that's why she picked that.
Never complains.
6 o'clock in the morning.
Do you get up to make breakfast?
Of course.
See,
Hot
so
breakfast.
Oh, look at that. We're going to
Yeah.
get your address. We'll be there. So we look forward to having you on the show. We're going to talk about internal medicine, some of the interesting cases they've brought, and maybe you'll bring some to the table. And Dr. Bruce Garner.
It's great to be back.
Great to have you here. How about your favorite movie?
I have to go with 3 because it's tough.
Okay.
I love Rio Bravo with John Wayne and Dean Martin.
Okay.
I loved Annie Hall. I think is the quintessential New York movie, Woody Allen. And the third one would be any Jerry Lewis movie. I love the Patsy, the Errand Boy. Yeah, my taste is very proletarian in movies.
Funny guy.
But I want to say this. My wife is up cooking them a hot meal every morning, too. One goes to Stuyvesant, one to Brooklyn Tech, but I drive my boys.
So you went up on that one.
Do you take the tunnel? Or
No.
The bridge? Okay.
Well,
So
my
tunnel.
husband drives my second one to Manhattan every
Really?
morning. He takes the tunnel, yeah.
Tunnel, so
Yeah.
$5.50. It's excellent. So this is why the kids turn out the way they do, neurotic. No, okay. And Dr. Danny Stevens, what's this? First of all, your favorite movie?
Big Lebowski, and then Rocky 1 and Rocky 2 have to be a close number 2.
Great movies, all great movies. I remember the lines in Brooklyn for the Rocky 1 and 2. Tell us a little bit about laparoscopic surgery. What is that?
Laparoscopic surgery is really insufflating the abdomen with gas, carbon dioxide, and making small incisions and using small instruments to operate rather than making a large incision. So it's minimally invasive, it's less painful, you have better recovery, and it's only going to get less invasive as the years go on.
So are people out there that going for surgery should be considering this? It might be maybe not great for everything, but maybe.
I think for many things it's the way to go, and you have to talk to your surgeon. Obviously, some things can be done laparoscopically, some can't.
Great. And you don't have any kids in high school, do you?
Not yet.
Very good. Okay. Enjoy them while
He's almost crawling.
Okay. But we're going to see who's on line 1. Could it be Grace? Could it be Maddie? Could it be Joel? Who knows? Let's see. Hello. Who is this, please?
Yes, it's Grace, Dr. Garner.
Grace, you made it
told me
again.
to call you back.
You made it again, Grace.
Yeah.
How have you been this week?
I had that major surgery on my eye. It was an emergency operation taking my cataract out because I had high glaucoma.
Right. I remember Grace.
Yeah, it was very, very bad. I had retinal degeneration in that eye, too, so it was an absolute emergency. They had to take me right in.
And everything is fine?
Well, they said everything was pretty successful, and my sight is coming back a little. I never had sight in that eye. Now I have like a little shadows, and I can make out maybe a finger or two. So it's pretty good. Maybe there's hope for me for that.
There is. We're glad you called us back, and you can see now very well?
Well, no, it takes a while. I'm on 11 drops for 5 weeks.
All right. You got to keep taking it, and then we'll see. What was your favorite movie, Grace, of all time?
Ben-Hur and Gone with the Wind.
Gone well. Excellent.
And King's Plaza closed. My diner.
The King's Plaza Diner. I went over there Sunday night, sort of to pay respects. It was mobbed. Were you out there?
Yeah, I didn't know. I can't go out with all these medications now.
But it will.
And I know the answer. I think I know the answer to the quiz.
Oh, okay. Take a step back from the phone. Okay. What do you think it is?
Thanksgiving.
I'm going to have to ask the judges on that. Judges, is the answer to the quiz Thanksgiving? Grace, my heart breaks for you.
Okay, I tried.
Next week. Take care. Now we're going to go to Ralph. Hey, Ralph.
Hello.
Hi, Ralph. How are you?
Good, thank you. Doctor, I have a pain in my the back of my left hip, and my rheumatologist gave me a steroid shot, but the pain persists. And last Saturday, I received a free deep tissue laser therapy treatment from a local physical therapist. And I was wondering, what are the benefits and risks of this treatment?
Okay, we have a rheumatologist here.
Well, I'm not sure. First off, where did you get the injection?
In the area of the pain.
Well, sometimes when you get pain in the back of the hip, Ralph, it's actually coming from the back. And it's pain where a nerve is being pinched sometimes, and the nerve travels down towards the hip. So that's why when the injection didn't work, it may be that the site where the pain was coming from was higher up in the lower back. That's certainly a possibility. In terms of the laser treatment that the physical therapist gave you, I'm not really sure exactly what treatment he gave you, so I won't be able to comment on that. I think you're best off asking him exactly what he gave you and what the risks are.
Uh-huh. Yeah, they advertised that you may need 3 or 4 treatments, but this was just to acquaint us. It was a LCT 1000 deep tissue laser.
Okay.
Well, if he says you may need 3 or 4 treatments and there are no significant side effects, that may be the way to go.
Right.
Ralph, what's your favorite movie?
Lily.
Oh, Lily. What was that one about?
That was about this girl in the circus, and
Hi, Lily.
with the marionettes.
Hi, Lily. Hi, Lo. Right?
Right. I saw it twice. I stayed to see it twice in the same day.
Yeah. Do you have to pay a second time if you see it again?
No, not in those days.
Very good. Okay, just checking
Listen,
on you, Ralph.
I think I have the answer to the quiz.
Oh, okay. What do you think it is? Which holiday brings in the most revenue after Christmas?
Halloween.
I have to go to the judges on that. Judges? Oh, Ralph.
Yes.
Ralph, and I see Alan emailed this. I want to say that Alan emailed this Easter, which is a good guess, but not the answer. What made you get this? Is it just the fact that Halloween is so close?
No, I think I read about it some time back. Doctor, is it true that with the plaque, it includes a free expense trip to Japan to pick it up?
Ralph, you're going to fly coach, Ralph. Well, thanks a lot. The plaque will be making its way to your house.
Okay.
Where is it going?
Rockaway Beach.
Which part of the house?
Most likely my living room.
Excellent. I think you're going to enjoy it. It's beautifully done. Our quizmaster takes a lot of effort, so you're going to enjoy it.
Okay.
Okay, Ralph, take care. Hi, Christian.
Hello.
How are you?
Good.
Good. How old are you?
I'm 9 years old.
Oh, one of our youngest callers. What can we do for you?
Well, I'd like to answer the trivia.
Okay. We actually had an answer, but
Okay.
I'd like to hear what you were going to say.
Halloween.
That was going to be the right answer. They say timing is everything in life, Christian, but you missed it by that much. Just tight. What's your favorite movie while I have you on the phone?
Well, one of my favorite movies is definitely Where the Wild Things Are.
Where the Wild Things Are. Is that cute?
Yeah.
So, Christian,
Yeah?
this is really nice to hear from you. Do you watch our show every week?
Yeah.
Good. So next week you watch it again and call in as soon as you know the answer.
Yeah, definitely.
Okay, great to hear from you. Take care. Hi, let's go to Judith now. Hi, Judith. Judith?
Yes, hi.
Hi, how are you?
I'm okay.
Where are you calling us from?
I'm calling from Brooklyn, New York.
Ah, which part?
Sheepshead Bay.
Oh, beautiful. We're just down there in that party city getting Halloween costumes this week. You know what that is?
Yes, I do, on Nostrand Avenue.
So crowded, yeah.
Yes.
Well, anyway, what's your favorite movie?
My favorite movie was Wall Street 1.
Oh, that was a good one. Wall
Yes.
Street with Michael Douglas. Very good.
Right.
Excellent. What can we do for you?
I wanted to call why a person feels tired, getting tired.
Okay, I'm gonna ask first. I'm gonna ask Dr. Katapati to discuss why someone might feel tired.
Okay. And I know somebody got the question.
Yeah, were you gonna say Halloween?
No, I wasn't going to say. I was going to say Mother's Day.
Good. I like that one. That's a good guess. Good guess. What do you think?
That's a very common symptom of a varied amount of diseases. So it's not very specific to anything. It could be anemic, it could be a thyroid, just not getting enough sleep, what Dr. Garner talked about the genes, and some people need more sleep than others. So that's a very non-specific complaint.
Okay, thank
Dr.
you.
Stevens, do you have any thoughts on tiredness?
Well, I think, as Dr. Katapati said, there's lots of reasons, but I think if it's really bothering you and you feel like you're sleeping enough, there may be something that you need to go to a doctor for to have figured out. You may need some blood drawn, some tests, just to make sure it's nothing serious. So it's never a bad idea to go see your primary care physician.
Thank you very much.
Okay, have a nice day.
Thank you.
Now we're going to go to the email questions. I see Jane in Middle Village sent us in an email, and she says, every time I have a blood test, whether the physician sends it out from his office or I go to the lab myself, something is always out of range. Do you think my thyroid is responsible for this? Or do you think the lab makes a mistake all the time? Interesting. Okay, so the lab, something's always out of whack.
Well, is it going to the same lab every time? Then it might be a lab error. If it's from different labs, and again, it's a general question you're asking. What specifically is abnormal is important. I mean, thyroid gland has an effect of lot of organs in your body. But thyroid abnormalities itself may not cause abnormal blood test results other than your thyroid hormone level. So I think you really need to specifically look at what's wrong, and if it's the same thing that's wrong every time or it's a different thing, maybe you just have to go to a different lab if it's the same lab that you're going to.
Very good. Any other thoughts from the panel?
Well, you have to wonder why Jane's getting these tests done. Is there something inherently wrong to begin with? The other thing is I find many times patients get nervous when things which are actually inconsequential are out of whack. For example, we get a test often called the CBC, which is a blood count. And there are individual components of the CBC which sometimes appear to be out of whack, but have no bearing on what the patient actually has and don't necessarily mean that there's anything wrong. So I would go over it with your doctor, Jane, and ask him or her if any of the results have a clinical meaning.
Interesting. Then, as a surgeon, what are you looking for?
I agree with that. When you get a lab report back, there's a whole list of numbers, and there's always something that's not within the exact normal range. So it's not uncommon at all to have something that's abnormal every time. So like Dr. Garner said, I would go over it with your doctor and make sure it's nothing.
Okay, Jane, thanks for the email. The rest of you, send in those questions. The best way to get in. We're now going to go, I think, to Larry from Rockland County, if I'm not mistaken.
Yes, Dr. Garner, how are you?
Very good. It's our season. Can you believe how fast the season went?
It's going with great haste. I'm sorry to see it leave.
Yeah, 12th season. Well,
yeah. And how many more programs do we have for this?
This is it. You're on the finale. We will not be back until January, the first week in January, first Tuesday.
Oh, gosh. Okay, we'll have to look forward to that.
You mark the calendar.
Yeah. Okay. Can I ask the rheumatologist, Dr. Garner, a question?
Sure.
I have a friend who is seeing an orthopedist, and this orthopedist is giving him injections into his knee, and they said that it will grow cartilage in his knee because he has no cartilage. Can this actually happen, and is this a new medication?
Can you regrow
no, you can't. I would suggest your friend see another orthopedist. he may be aligned with the previous physical therapist who told the gentleman that he needs at least 4 laser sessions to take care of him. If your friend has good insurance, that may be another reason why the orthopedist is telling him he's going to grow cartilage. But seriously, man has tried the same way we try to change water into wine. Or the same way my wife tries to stretch my salary out and make it a lot more than it is. Can't be done. Man has tried to grow cartilage for a long time, and there's no way of doing it just by injections. I suspect the injections your friend is getting. Larry, it's Larry?
Yes.
Okay, Larry, I suspect the injections that your friend is getting is something called either Symvisc or Hyalgin. These are oils for the knee, and that's one of Dr. Garner's myths, maybe for January, for Sweeps Week. It is a myth that amongst people that this will grow cartilage. It doesn't. It's a lubricant for the knee. It's like 1040 in the knee.
Interesting. Larry, what's your favorite movie?
How Green Was My Valley?
Greer Garson and Roddy McDowell.
That's
a lot of time on you.
No, Dr. Bruce, he knows. So, Larry, thanks a lot for the call.
Okay.
We'll see you in January.
Okay. Good luck.
My favorite movie was Splendor in the Grass with Natalie Wood.
And Warren Beatty. Great movie.
Was it Natalie Wood or Woods?
Wood.
I knew it. I knew it was Wood. That's what I was.
He's a restaurant expert and he's a movie expert.
What poem? That's a good question. Did that come from?
Splendor in the Grass.
And who wrote it? A famous Brooklyn poet.
Whitman?
Walt Whitman. No, nothing can bring back the hour of Glory in the Flower.
Very sad movie. Always, I don't want to admit to crying during a movie, but it's a sad one. Hey, Savi, how are you?
Okay.
That's a nice name. Where's that come from?
Guyana.
Interesting name. What does it mean? Knowledge?
I have no idea.
I think it means knowledge. Yeah. Very good. Where do you, what's your favorite movie?
I don't really have a favorite movie.
You don't, do you like to go to the movies or you don't like?
But I like yes, I like going to the movies.
Yeah. So you don't really have one, you just enjoy it in general?
Yes.
Okay, where are you calling us from?
I'm calling from Queens in New York.
Oh, very good. And what can we do for you?
I always get these infections, like, in my vagina. And every time I go to the doctor, I have to get antibiotics. And this is like 3-4 times a week.
Mm-hmm.
So I don't know what causes this.
Okay.
And it's severe infection.
You know, I mean, there's a lot of causes for that. You know, people sometimes wear the clothes that are too tight, or right.
Cotton. You should be wearing cotton and not synthetic.
So it really has to do with preventative measures you can take as far as showers twice a day, using the appropriate.
So, but these infections is like I can't walk when it starts.
Yeah, no, it can be very painful. Have anything grown out? Have they told you what's the cause? They know what the bacteria is?
They say something like fungal infection.
Fungal, yeah.
Right.
And it's very painful and hurtful.
Yeah, I mean, this question, I'm going to ask the doctors on the panel to talk can deal. You're not diabetic, are you?
No, I'm not.
Okay, because there's certain causes. Dr. Stevens, why don't we start? We'll work our way around.
Well, you know, one issue is, Savvy, is that if you're having recurrent infections and they're treating you with antibiotics and more antibiotics, the fungi that are growing may be resistant to these medicines. So, you know, you may need a different type of treatment. You may need intravenous antibiotics or antifungal medicines. So if it really may be the same infection that really just hasn't gotten better in the first place. So, you know, if it's really bothering you, I might see a doctor again, and he may choose to admit you to the hospital for some intravenous medicine. Maybe one way to go.
Can that come from sexual intercourse?
It's possible, yeah.
I would agree with Dr. Stevens' assessment.
Good.
Yeah, basically.
Thank you so much.
Wait, Dr. Kadapani's going to weigh in on this.
Yeah. Well, first of all, you need to treat the infection. I mean, the antifungals is important. You can also take pills, antifungal pills. So if the creams are not working, you can take pills. And then next is to prevent, like Dr. Garner said, the correct kind of clothing and not to have too much heat. Moisture and heat actually, make you more prone for those infections. So just, general good hygiene and proper clothing. Okay?
Thanks, Avi. I hope you feel better. I just want to point out, last week we spoke about a young lady, Amanda. She was, I think, 12, donated her hair to medical purposes. And she had sent in a picture to show us, but it's not the best picture, so we're not going to show it. But we want to, again, recognize this wonderful act, Amanda Morell. Thank you very much. We're now going to go to Stephen on line one. Hi, Stephen.
Hi, doctor. How are you?
Hi, where are you calling us from?
Bensonhurst, Brooklyn.
Very good. And what's your favorite movie out there?
The Wizard of Oz.
Where did you first see that one?
Oh, geez, many years ago. Home.
Yeah. Do you remember the Marlboro movie theater with
Jaws?
Oh,
yeah, absolutely. Absolutely.
I remember a line around the block to see Jaws and Rocky.
Yeah. Absolutely.
What can we do for you?
Yeah, I just have a question for my son. He's 27 years old, and for the last year or two, he's been having these things in his wrist. He would wake up in the morning, it would be swollen like in one wrist and red. Then it would disappear, be very stiff. He couldn't move his fingers. Then it would free up and he'd be fine. Then one or two of his digits of each finger would get red in one spot and swell, and that would happen on both hands. And it's been happening for the last maybe, say, year and a half, 2 years. So he just went to a doctor for RA factors and a bunch of blood tests. We didn't get the results of that yet, and we're just trying to figure what it possibly could be. Could it be like an arthritis, a rheumatoid arthritis, or just a ganglion on the wrists, or whatever. We're just trying to figure it out because he's been having the bouts for a while, and when he wakes up, he can hardly move his hand, even turn a car wheel, anything like that for the first few hours.
All right, let's see what our rheumatologist says.
Okay. Number of possibilities, and you're right to go to a doctor who's going to help you narrow it down. One possibility is he may have one of a group of diseases called spondyloarthropathies, and that can come on this way. Does anyone in your family have either psoriasis or inflammatory bowel disease, such as Crohn's or ulcerative colitis?
No, he does have not psoriasis. He has the eczema he's being treated for now.
That eczema may, in fact, be psoriasis, and he may have something called psoriatic arthritis, and that's a diagnosis that the doctor will make based on his symptoms and based on the pattern that the arthritis takes. The other possibilities with episodes of arthritis like this would include gout or a disease called pseudo-gout, which are caused by little crystals in the body, which actually come inside the joints and they stick you from the inside out. Rheumatoid arthritis, and you bring up a good point that he's being tested for the RA factors. It turns out that 20% of people who have rheumatoid arthritis will not have a blood test which shows it. So you have to be careful with that. You did the right thing, take him to a doctor. The doctor's going to run some tests and ask some questions and examine him, and he should be able to come up hopefully with an answer to make your son feel better.
So you
Thank you. I hope that helps. Take care.
You think it's a possibility that the eczema could be a cause with the arthritis?
I think it may be associated to the eczema, and I would bring that to the doctor's attention.
Oh, okay.
Okay?
Thank you so much.
Take care.
Very welcome.
I know we have Dr. Stevens. We're going to be talking to him in a little while about laparoscopic surgery, but I know he was talking about two loyal fans of the show from his building. Want to make sure that the door opens for him.
Frank and Ephraim, we really appreciate you watching, so keep watching.
Yeah, thanks
and
a lot.
call in.
Okay, now we have an email question from Alan. A relative has experienced a recurrence of her cancer. As a consequence, her platelet count is low, and bags of whole blood, I assume, are being hung to elevate her platelet count. Is it possible to use centrifugal force to separate platelets from whole blood and then infuse only the platelets? If this can be done, then the infusion would be more concentrated with platelets and less dilution from other blood elements. Perhaps this would be a way to bring up the patient's platelet count faster. And my quiz answer is Easter. Well, thank you. We know that Easter is not the answer, but a good guess. But any thoughts on giving platelets versus whole blood?
Well, usually if your platelet count is low, it's platelets only that we do transfuse. It's not whole blood. But even that, you have to have specific indication for that. You know, you have to have a specific number. Usually, if it's above 50,000, you don't do anything. And if it's below, but it has to be even actually below 10,000 for them to just transfuse without any trigger. But if they're going for surgery or if they have anything where they might have a tendency to bleed, you might transfuse before that. So just because the platelet count is low, you don't transfuse. And definitely it's platelets and not whole blood.
Thanks. Thank you.
I don't know if you want to add anything.
We're looking at full, I've never seen a constant full line, so please be patient. We're going to take a short break to pay some of the bills. When we come back, we're going to be talking about internal medicine, rheumatology, laparoscopic surgery, and general surgery. The number is 718-499-6101. And remember, now you can email us any questions or comments at askthedoctor@netny.net. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where our topics are internal medicine, rheumatology, and surgery. With me, I have Dr. Katapati, an internal medicine attending at New York Methodist Hospital, Dr. Bruce Garner, Chief of Rheumatology at Lutheran Medical Center, and Dr. Daniel Stevens, a laparoscopic and general surgeon at the Metropolitan Hospital. We're going to get right back to your questions. I just want to correct something that I said a little earlier. This is our season finale, so next week there will not be a live show. So those who I told to call in, don't call in next week, but call in the first Tuesday in January, okay? And now I understand that Joseph is here. Where's Joseph hanging out? On line 4. Hi, Joseph.
Hi, doctor.
Joseph, how are you tonight?
Good, thank you.
Where are you calling us from?
Sheepshead Bay.
Oh, Sheepshead Bay. Very nice. You ever eat that place Seniors before it closed?
Oh, sure.
That used to be a nice place. Yeah. I don't know if anybody, our other listeners. That was a huge place. Delicious, delicious service. And I know
I'm 71 years old, so I've been there quite a bit.
And the Kings Plaza Diner we miss? What do you think? No?
It's okay. A lot of people are really all upset about it. But too many times they brought out dishes that weren't washed.
Yeah.
But that's another subject.
All right. Thanks, Joseph. Appreciate that. What can we do for you?
I didn't mean to throw that in. I'm cold all the time.
Okay.
And I've gone for extensive blood tests, and they say you're a healthy man. I'm overweight a little bit, maybe too much. I'm 5'7", 206 pounds. and I don't have diabetes. I fell about a year ago. I'm on different medications, which I've kind of pretty much cut out.
What was
I'm
the
on
fall? You tripped, or did you fall from you lost consciousness?
No, I didn't lose consciousness.
Okay. Why did they say did you fall because you tripped over something?
Yes, I tripped on a wire that was sticking out from a machine at work.
Okay. Let me ask Dr. Stevens to start, and then we're going to work it. Why should he be feeling cold all the time?
Well, it's possible that some of the... how long has this been going on, Joseph?
1 year.
1 year. So, it's possible that the fall may have done something to your blood supply, to the nerve supply, to your extremities. It's also possible that some medicines that you've been taking since then are causing some of these symptoms. What medicines are you on?
Well, I'm on Trico, which had nothing to do with that. That was for triglycerides.
Okay.
And I'm on another one for METHOCARBAMOL.
Mm-hmm. Is that yeah?
It's like a relaxer kind of thing, I think.
Oh, something to relax the muscles. Does anything? Why does he?
Well, I mean, usually anemia or thyroid disorders, can cause this kind of symptom. But I don't know, you said you had extensive blood work and everything was normal. Did they check your thyroid? I mean, that's not something that they do routinely unless they're specifically looking for it.
Yeah, I'm pretty sure they did because I told them that I'm cold
and your
all
blood
the time.
count was okay too?
Right.
You have no other symptoms, no like cough or anything like that?
No, I feel fine.
It seems like as people age, that the cold bothers them more. We see that all the time.
I think I recall vividly my grandmothers in the hottest days of the summer, we'd be eating and they'd be wearing a sweater. And one of my grandmothers, it would be 105 degrees, she wouldn't turn on the air conditioner. It was because she was cheap. It had nothing really to do with it. But I think
a lot of times now my wife is putting on the ceiling fans and opening the weather, and this type of weather would shoot the base.
Joseph, so we've got to move on, but basically it doesn't sound like there's a big medical problem, but we
actually, is there an internist that you'd recommend?
Well, I recommend Dr. Katapati. Her numbers
if you want
on
to come
there.
see me, you're more than welcome. We can try to figure it out.
Joseph, how the 3-star, the dish is clean in there?
Excellent.
Excellent. Okay, thank you very much. I appreciate it. Okay, let's go. Now Joseph's on his way. Now we'll talk to Sharon. Hi, Sharon.
Hi.
How are you?
Okay.
You're all excited. Is this the first time you've gotten through?
No, second.
Second. Did you have the answer to the quiz?
The quiz, I didn't hear that part.
Oh, okay. I don't want to upset you, so you probably would have gotten it. So let's not even. Tell me, where are you calling us from?
Flushing, New York.
Very nice out there. What's your favorite? We're talking about favorite movies of all time.
Well, I love Jesus of Nazareth.
Beautiful.
Okay. And I like The Sound of Music, too.
Sound of Music.
Yeah.
45 years old today.
Is it?
Yeah. Can you believe that?
Wow.
You saw that on Broadway, huh?
Oh, I love that show.
Beautiful. What can we do for you?
I recently had a blood test.
We had a little technical difficulty, so I would like you to call back to this call, and we're going to go to an email while you call back. We'll get back to the caller. That was Sharon. Sharon we're going to talk to. This is the email question. A friend of mine recently fell down some stairs, and she says she's okay, but she seems more disoriented than usual. Should she pursue medical help?
Oh, yeah, definitely. Any change in mental status after a fall, I mean, it depends on the age and what medications he's taking, but definitely you need to be evaluated. It could be a subdural hematoma sometimes, where you're feeling fine for a few days and then later on you develop symptoms. Or it might be just a concussion, but, definitely you should seek medical help.
Dr. Stevens, any doubt?
Absolutely, and it also could be something that caused the fall. You want to make sure, you didn't have a stroke, God forbid, or something like that, so definitely need to see a doctor.
Oh, great. And Sharon, call us back, okay? We want to hear that question. I'm sorry you got cut off. Now we talk to Mary. Hi, Mary.
Yes, I am here.
Where are you calling us from, Mary?
I am calling from the beginning of Sheepshead Bay, Garrison Beach area.
Oh, that's a nice area. We like that a lot.
Yes, I do, too.
No movie theaters out there, huh?
Yeah, there's the big movie theater.
Oh, right, the one off the Bell Parkway.
Off the Bell Parkway, but I watch most of my movies on TV.
So what's your all-time favorite movie?
Going My Way.
Very nice movie.
And The Bells of St. Mary's.
And what about A Wonderful Life?
That was one of my favorites.
I love that movie, yeah. So what can we do for you, Mary?
Well, I just called in really to thank them so much. They are a godsend.
Who is that?
thank the doctors so much
Oh,
for
this is
the
great.
programs.
Yes, yes.
Thank you.
They really are a godsend.
They come here, after work, very tired. And
I know. I have a son and a daughter-in-law doctor in Jersey, and in my family, and they're just a godsend.
Thank you very much for recognizing
No, I mean that from my heart. I did talk to them once before. My husband passed away 5 years ago.
Oh,
I had
sorry.
a great marriage for 55 years. And I didn't want to go to Jersey to I was lost. And I did call that time. Otherwise, I never can get through, really.
But you stay with us. Don't move out to Jersey, all right?
No, I have no intention.
Very good. What can we do for you tonight? Anything?
I just wanted to thank you very much.
That's really nice, Mary. Thank you so much.
You are really a blessing.
And I hope you called just to say hello without any medical problems. Okay?
Thank God, for almost 82, I am doing very well.
You are. Be
I
well.
have a few medical problems which you expect to have, and I cannot walk the miles I did, but I still do well.
Sound like you're doing pretty good.
Every day is a blessing.
Call us back in January.
All the best to you, and God bless you.
Thanks a lot. Be well. I see we have Amanda. I don't know. Is this the same Amanda?
Yes.
Oh, Amanda's so happy and always excited.
Hello. Hi. Thank you very much for, again, pronouncing me on your show. It's very good, just so you know.
We had a beautiful picture of you, but it didn't quite project. It didn't do you justice, so I didn't want to send it because you look so beautiful in the picture.
Oh, thank you. Yeah, my mom's going to send a new one in.
Send it in
and
January.
I think everybody should do this because it's a good cause.
Yes.
Because of people who watch your show, and that it would be a very good cause. Because 8 hair ponytails make a wig for a kid in cancer.
Oh, beautiful.
For a child that has no hair.
Beautiful. So we're gonna see a picture in January, okay? You'll send it in. We have plenty of time, and it'll be like a little cliffhanger.
Okay, perfect. Thank you.
Bye, Amanda. Have a nice next couple of months. We're now going to go to Annette. Hi, Annette.
Yeah, hi.
Hi, where are you calling us from?
I'm calling from Canarsie.
Oh, beautiful area. We like that a lot. Do you ever go to the Canarsie movie theater?
Sometime, not very. I don't go to movies very often.
So what's your favorite movie?
Ben-Hur
Yes.
and Cleopatra.
Beautiful. 2 great movies. Ben-Hur has a couple of votes now. Yeah. So what can we do for you?
I want to know what's causing me to have the tingling in my right leg. I had a hip replacement back in 2005 when I retired, and I had arthritis. It ate away my hip, so they gave me an artificial hip. So I'm wondering if that have anything to do with it, and it caused me not to. I have a hard time breathing. When I'm walking, I have to stop and rest. I feel like my chest is closing up on me.
Okay, Dr. Garner.
The answer is it's highly unlikely that the hip would be causing the tingling in the leg. But there are a number of things which could be causing the tingling in the leg, and you really need to discuss this with your doctor to begin to investigate what they might be. It sounds like there's a nerve which may be inflamed, and that can be caused by many different things. So that, coupled with the shortness of breath, I think you really need to see. We'll give you Dr. Katapati's number if you need a good internist, but I think you need to see a good internist to begin to work it up, but it's probably not the hip.
Thanks, Annette. I hope you feel well.
Thank you.
We're going to get to Elsie in a second. I just want to ask Dr. Stevens, what is appropriate, for this laparoscopic where you don't cut them open and they recover quicker? What types of procedures can we do like that?
Well, traditionally it's gallbladders, appendix, now hernias, all sorts of cancers now it's accepted to do laparoscopic surgery. Colon cancer, gastric cancer,
Amazing.
even pancreatic cancer. GYN cancer, so all sorts of operations.
And how soon do they go home?
You can go home the same day.
This is amazing. You take out a gallbladder and the patient goes home?
They go home the same day.
So this is,
most of the time.
it almost sounds like you shouldn't be going for regular to the older way, but you should be going for the laparoscopic now.
Well, a general surgeon knows how to do it all. You know how to do laparoscopic, open. It's a technique, really. So it's really changed.
It's exciting.
It's really
exciting
changed
stuff.
things a lot.
Yeah.
It is.
Well, not everybody is a candidate for laparoscopic, but I guess.
Right. You have to talk to your surgeon and see if you're a candidate. But
can we do that weight loss? That the bariatric surgery like that?
Bariatric surgery. 95% of bariatric surgery now is done laparoscopically. So the recovery is great.
Okay, thanks a lot. Now we got Sharon back, I'm happy to say. Hi, Sharon.
Hi.
Oh, thank you. I'm so sorry I clicked you off before. How are you?
That's okay.
So what can we do for you?
Oh, I just wanted to know when you have a high C-reactive protein, I have it on my blood test in front of me. It says it could be elevated in patients with inflammatory disease.
Okay.
I
yes.
don't know
What's the cause? What does it mean?
Yeah.
Well, C-reactive protein has been used for many years to see if there's inflammation in the body. Recently, it's been used more often to see if there's any cardiac disease. It might be a clue that there's heart disease if the C-reactive protein is high. So was there a reason that your doctor got the C-reactive protein? Was he looking for anything, or he just did it as a general exam?
I do. I have high cholesterol, and I was on Lipitor, and then I came off it because I felt like my muscles were hurting and my joints, and so now I'm on nothing. But he did ask me to go on Zocor, and I didn't.
I think you should go on something, and it sounds like your C-reactive protein may be related to cardiac status, so it's something to discuss with your doctor.
Okay.
And he may want to get a good look at the heart.
Oh.
Okay.
Okay, great. Thank you.
Thanks, Sharon. Great to hear from you. Call us in January.
Oh, I wish you were on all year.
I know. Thanks a lot.
You have. God bless you.
Thank you. We're now going to go to Elsie. Hi, Elsie.
Hi.
Where are you calling us from?
I am calling from Bayside, Queens.
Oh, my daughter used to live over there at the Bay, the Bay Terrace with those buildings?
Oh, yes.
Beautiful.
That's beautiful there because that's by the water.
Yes.
I am more south, close to Oakland Gardens, but it's still a part of Bayside, and it's a lovely place to live.
Beautiful shopping center with some restaurants there.
Yes, very nice.
What can we do? Well, first of all, what's your favorite movie?
My favorite movie, well, I have a few, but one of them is Sound of Music,
Beautiful.
and second is Casablanca.
Ah, another great movie.
Yes, very nice. And thank you, Doctor, for this most wonderful, blessed program that you give to us, the people, every week. It is very helpful and wonderful to listen to.
Thank you. Thank you for the kind words. What can we do for you today?
Well, I was diagnosed with arthritis many years ago, which I've been struggling with in my back with the herniated disc and so on. And all of a sudden, 3 years ago, the blood test showed that I had rheumatoid arthritis. Well, I was so surprised a month ago when I had another blood test showed that I do not have any rheumatoid arthritis showing up in the blood test anymore. And I was wondering, have I been healed from it, or is it a mistake, do you think?
Let me ask Dr. Garner. We're going to now do 1 minute answers. Dr. Garner?
Okay, I'll speak very rapidly. The test called the rheumatoid arthritis test, that's a misnomer because it can be seen that test positive in 25% of the normal population. It is not diagnostic of rheumatoid arthritis. You could have had a positive test because you had a virus at the time. The other thing is rheumatoid arthritis doesn't affect the lower back. So unless you had symptoms of swelling of the hands, the knees, and the feet, there was no reason to even get that test, and I won't get it again.
No, I don't have that, but I have a second question. I was just also diagnosed with a growth on the thyroid, and I was wondering, is that very serious, and what should be done about it?
I'm looking at Dr. Stevens now.
I'll also give a 1 minute answer. You should definitely get a biopsy of that mass, Elsie. They can appear different ways on an ultrasound or a CAT scan or an MRI, but if it's suspicious, then you should talk to the doctor who ordered it. They may want to do a biopsy, and I would definitely recommend that if that's what he or she wants.
Okay, and what kind of a doctor should I see about this?
Probably a head and neck surgeon.
Head and neck surgeon.
Yeah, ENT.
Okay.
Thank you, Elsie.
Thank you very much.
Thanks for
God
calling.
bless you all.
You too. Patricia.
Yes, good afternoon, or good evening, I should say.
Good evening.
So.
How are you? How are you doing today?
I'm well, thank you, and yourself?
Very good. What about your favorite movie?
My favorite movie is The 10 Commandments.
Beautiful. That also got a couple of votes here. Excellent,
Yes.
excellent choice. What can we do for you?
I was diagnosed with rheumatoid arthritis back in 1994.
You're wearing Dr. Garner out here tonight. Yeah, okay.
And I have been responding well to Humira. I have since developed some complications in both of my ankles, and my feet have suffered great deformities due to the RA. But a former caller was talking about a relationship between Crohn's disease in the family line. I have since, my mother had Crohn's disease, and I am now presenting with some redness of the skin that almost looks like psoriasis on the upper forearm and in the middle of my neck. And I wanted to find out, is there a relationship between Crohn's disease and rheumatoid arthritis?
Excellent question. There's not a relationship between Crohn's and rheumatoid arthritis per se, but Crohn's disease can be related to an arthritis that looks just like rheumatoid arthritis. And sometimes this arthritis can appear, I've never heard of it appearing more than 10 years before, but the arthritis can appear up to 5 years before the Crohn's disease occurs or the psoriasis. It's certainly a possibility, but the treatment would be no different since you're responding well to Humira.
Thank you so much for the call. We're going to have to move on. We got Buddy now. Buddy's joining us on line 3. Hi, Buddy.
Hello. Can you answer my question, sir?
Please, let's hear it.
Okay. I feel that perhaps my problem is out of your general field, but I just thought if you had any ideas. I'm a gentleman that's in my 70s, and the last 3 years I haven't been able to have sexual relations. And the problem is that I do have an enlarged prostate, and the urologist suggested I take testosterone. My fear of taking testosterone is it could lead to a cancer.
It definitely could. You know, and a lot of studies, because we can talk a little bit about this, show that the testosterone really doesn't help. That it has a lot of risks associated with it. Not a lot of upside. Not a lot of positiveness. You have an enlarged prostate. Do you have diabetes?
No, sir, I don't. I'm in good shape. I'm late 70s and in good shape.
Have you tried some of the medications?
Well, I have tried. Well, I have tried Viagra and the other medicines for the. To generate.
Let me see if anybody else on the panel has some thoughts.
Well, let me just interrupt and say my cholesterol, because I don't eat red meat. I don't eat meat at all, but my cholesterol is like 106. Now I'm applauded for that issue. However, I just thought that I may be devoid of some type of missing some type of chemical or mineral in my body that would help me get back to having a sexual relationship. Do you have any ideas, gentlemen?
It is a low cholesterol.
Well,
106.
I'm afraid it is out of my field, buddy. I wish you luck, but perhaps you should see a good
I
urologist.
Think,
I have seen them, and they have admitted that they can't guarantee me that that you couldn't get a cancer from.
You know what it is, buddy? I have an excellent GU doctor coming on in January, Dr. Grimberger.
Right.
We're going to comment on that, and also if you email me, I'm going to turn his question over to him. Okay?
Okay, sir. Okay. Thank you for your time.
Elena.
Hello,
Hi,
how are you?
Is it Elena or Elena?
Elena.
Elena. Where are you from?
Sheepshead Bay.
We got a lot of Sheepshead Bays out there today.
Isn't that so?
Yeah.
Yes. How are you?
Okay. First, what was the favorite movie?
Picnic.
Which one was that?
Picnic?
Picnic.
William Holden and Kim Novak.
Kim Novak. Wasn't that fabulous?
Wonderful movie. It must have been Moonglow.
Okay, luckily we only have a minute left.
The dance.
Okay, what can we do? I'm seeing Marcia. We're going to take one quick call. Any quick question for you?
Yeah, I had a very bad case of shingles a couple of years ago on one side of my body, and I am now continually breaking out on that side of my body in these very painful blisters from my head all the way down to my ankle. It's continual. It'll go away, and then it'll pop up on me again, and I don't know what to do. I was hospitalized. That's how bad it was.
Well, basically, you can have a lot of pain, what's called post-herpetic neuralgia. It's a nerve-related pain. I'm not sure what the blisters are. Usually the blisters don't come back, but usually there's medication you can take for this neuralgia and control the pain at least. But this blisters, you might have to see a dermatologist just to make sure it's nothing else,
I see.
What do you think, Dr.
I would
Garner?
agree 100%.
Yeah.
I'm going to have to move on because we have only 1 minute left. But thanks for the call. See you in January.
Sure enough. Bye-bye.
Beautiful. Marta. Marta? Hi, is it Martha or Marta?
Martha,
Martha. And where are you calling us from?
Manhattan.
Manhattan. Where's your favorite movie of all time?
Mamma Mia.
Oh, was that yeah, Mamma Mia.
Yeah, made a
New
movie.
movie.
show.
New movie. Did you see the show?
Yes, I'm looking at it.
Oh, how do you do that?
Well, I can't. It's blank now. I can't see you guys.
Oh, okay.
I can hear you.
What can we do for you?
Well, I've been diagnosed with fibromyalgia.
Okay.
And I wanted to know where that comes from.
Well, nobody knows where fibromyalgia comes from, Martha. It's a syndrome rather than a disease where people have some degree of pain over the whole body usually, which is constant. And that's one of the things we were talking about, people being tired. People feel tired all of the time. We don't know where it comes from. There's a lot of research being done on it, and hopefully within a few short years we're going to have a cure for it.
Martha, thanks a lot.
Thank
We'll
you
look for
very
you in
much.
January, okay?
My doctor put me on Lyrica. That's why I was concerned.
One of the good medications that seems to help with it.
And it's a combined approach for that, physical therapy and medications.
Thank you. Well, I can't believe we've come to the end of the show. Good calls,
Great
variety
show.
of calls. You
Very
never
fast.
know what's going to call on live TV. But anyway, I want to thank you for this episode. We're watching. Thank Dr. Katapati, Dr. Stevens, Dr. Garner for coming in. And we hope we were able to help you. It's good to remember that you should always be proactive about your own health. Speak to your doctors about your concerns. Go for second or third opinions. In the meantime, visit our website at netny.net/askthedoctor. Here you can see video blogs, the tablet column, podcasts, the forum. You can send in your quiz suggestions and many more. You can also watch last week's episode tonight at 10 p.m. and more past episodes every morning at 10 a.m. This season has been great, and I want to be the first to wish everyone a Merry Christmas and a Happy New Year. I want to thank Linda Lapatosa, our quiz master, and most of all, I want to thank all of you for your questions and tuning in. Goodbye, Merry Christmas, and I'll see you in the tablet.